The future belongs to our children. We must strive to keep them healthy and strong by providing the very best medical care. Born out of this need are two similar health insurance programs for children. Both are designed to ensure that every child in North Carolina, regardless of family income, has access to the proper medical care. Health Check, also known as Medicaid, and North Carolina Health Choice are both affordable health insurance programs designed for children. One program offers free and the other low-cost insurance for children under the age of 19 and in some cases up to the age of 21. Covering your children with one of these programs allows you as a parent or guardian to establish a medical home for your child. A medical home is any one location you choose where all your child's health care needs can be taken care of. For instance, a pediatrician's office, a community clinic, or a local health department can be considered a medical home. Services provided by a medical home can include, but are not limited to, checkups, sick visits, accidents, special health needs, and immunizations. By contrast, the local emergency room is for true emergencies, times when children may lose their life or risk their health without immediate treatment. The ER should not be used as your child's primary care provider or medical home. Keep in mind, it is rare when children need to be seen in the ER.
Examples of things such as a bad laceration that may require stitches, problems with breathing, asthma, where your child's not responding to their home treatment. These are things you may need to come to the emergency department for. Traumatic injuries of your child, if they fall down, hit their head, nausea, vomiting, certainly these are things that you may even want to call 911 and bring your child in. If you look at injuries to their extremities, they fall down, they've hurt their arm, their leg, and they really won't use them any further. Appropriate time of observation, but they're not improving. You may need to come to the ER for that.
But a child who might have a fever or a cold or a runny nose, something that you might typically treat in a regular office, should be seen in the medical home, in the pediatrician's office or their medical provider.
The advantages of having a medical home are many. By establishing a health history with one primary caregiver, you ensure that your child is known by the doctor or medical staff. This intimate knowledge of your child's health history by the medical home allows them to catch problems before they become too big, to make sure your child gets the screenings and shots needed to stay well, to refer you to the right specialist and equipment if needed, and to give advice and inform you of helpful community programs.
And if you go to your own family doctor, get to know that person, they get to know you, you develop a good social rapport. They know about your medical problems, they know the medicines your child's on, they know their growth chart, they understand their allergies and how they might best respond to medical care. This is an individual you can rely on when more acute urgencies or ailments come up, coughs, colds, fevers, somebody you can talk to.
It's very important to have a medical home. There are several advantages. I think the main one is you get a continuity of care. The primary care provider, whether it's at a pediatric office, family practice office, healthcare, health department, will know the child's history on a continuous basis, and in many cases, especially family practice, will know the family history because we've taken care of the parents as well.
You should always contact your primary care provider or medical home first for advice on treating your child.
It is a way that the children can be followed, problems can be recognized early, appropriate referrals can be made. We can follow development, we can make sure that appropriate immunizations are given. It just makes good sense for children to have a medical home where they know the people caring for them and the people know the children.
Your medical home is available 24 hours a day, 7 days a week, and is best able to tell you if you should treat your child at home, come into the office, or go to the emergency room.
We're available 24 hours for consultation by telephone. The parents page the beeper, we call them back, and we answer any questions that they might have.
In our practice, it's easy to access advice after hours. We have a provider that's on call all the time. In our particular practice, we have 4 MDs and 2 mid-level physician assistants One of us always is carrying the beeper. To reach the provider, the patient would call the office number and they'll get a recording with the name of which provider is on call and a beeper number to call.
After 8 o'clock, if a parent has a question or a problem, we have an advice nurse line called the Health Link. The patients call our office, a recorded message gives the number that they call, and they speak with pediatric nurses in Chapel Hill, who then direct care or page us directly to speak with the patient.
Let's take a closer look at the Health Check and NC Health Choice insurance programs. It's estimated that nearly 12% of North Carolina children are uninsured. Almost 70% of these uninsured children are eligible but not enrolled in Health Check or the NC Health Choice insurance programs. Health Check is North Carolina's Medicaid program for children. To qualify for this program, your family's income, the number of people in the family, and the age of the child are taken into consideration. For those who do qualify, Health Check requires no yearly enrollment fee and no co-payments.
It helps children obtain health care that may not otherwise receive health care. I like it because it's a very uncomplicated system. No matter what the child needs from a medical standpoint, there's nothing that stands in the way.
Health Check and North Carolina Health Choice are excellent programs. We're very lucky in the state of North Carolina that we have progressive thinking folks that understand the importance of providing good care for all children.
Well, it was back in 1990. I took custody of my 2 granddaughters because their mother came into some hardship and she could not take care of them anymore. And I stepped in to finish raising them. Well, discovering Health Check, it was really a godsend to me because it wasn't based on my income. It was based on my daughter's income, and that qualified the girls to get help.
Once enrolled, the benefits are numerous. Services covered under Health Check include checkups, prescription medicines, sick visits, dental care, immunizations, hospital care, lab tests, counseling, therapies, surgeries, medical equipment, and vision and hearing care. Transportation to and from medical visits may also be available. It is very important for all children to get regular medical checkups. These medical checkups are called well child checkups. A well child checkup consists of a health history and physical exam, measurement of height and weight, a check on developmental level and mental health, immunizations if needed, various other tests including tuberculosis and lead poisoning, and health education. The recommended schedule for these checkups are seen here.
A well child check for children involves a height and a weight. We monitor these over time to assess for problems and early intervention. We do vital signs. We provide immunizations that are age appropriate. We can deal with safety issues for the different ages and school issues for the different ages.
Most of all, it gives us a chance to talk to the parents of the young infants and the children as they get older about healthy habits and healthy lifestyle choices because that's really our chance to maximize the child's development and to achieve all that they can as they get older.
Well child checkups prevent illness and find problems early so that your child can stay as healthy as possible. Keep in mind that Medicaid and NC Health Choice will cover well child checkups from birth to age 20 and any medical treatment or remedial care that is found to be necessary after receiving a checkup. Also remember, with Health Check and NC Health Choice, your child is eligible to receive dental screenings every 6 months. NC Health Choice is the other children's health insurance program. NC Health Choice is insurance for children of working families who don't qualify for Health Check, but who may not be able to afford private insurance.
I was laid off last year from my full-time job because the company was downsizing, and what I found was that keeping up with all of our bills and expenses was getting harder and harder, and I'm a single parent with 2 young children. One of my biggest concerns was health insurance for my kids. In the past, my job's insurance program covered them, and since the layoff, that's not available. With medical costs being so expensive, just one trip to the emergency room or even just a routine doctor's office visit was way beyond what I could afford. But how can you let your kids go without medical care? You just can't.
How much a parent or guardian has to pay under this program is determined by the family's income. Depending on income, you will either have small co-payments for prescription drugs, or you will have a yearly enrollment fee plus small co-payments for prescription drugs, some office visits, and non-emergency visits to the emergency room.
I recently discovered the Health Choice program, and it's been a huge weight off my shoulders. The cost is minimal, and the kids are covered for everything from routine checkups, immunizations, surgeries, and even their dental care. Now, both of them have asthma, and my Health Choice insurance has actually allowed me to get their medication at no cost. It's been wonderful, and I had no idea I would qualify so easily for such an affordable program.
Services provided under NC Health Choice are similar to those offered under the Health Check insurance program and include checkups, medicines, sick visits, dental care, immunizations, hospital care, lab tests, counseling, therapies, surgeries, medical equipment, and vision and hearing care. Enrollment in either the Health Check or NC Health Choice program is quick and easy. All that's required to start the process is an application. There is only one application for both programs. If you do not qualify for Health Check, the same application will be used to see if you qualify for NC Health Choice. Applications can be obtained in 3 different ways.
Applying was very quick and easy. Now, I went down to my local health department and picked up one application, and filled it out. But I understand you can also apply online or by calling an 800 number.
Application can be found on the web at www.nchealthystart.org. An application can be mailed to you by calling the NC Family Health Resource Line at 1-800-367-2229. Or you can pick up an application in person at your local Department of Social Services or Health Department. So in review, a medical home is the one place you can take your child for all their health care needs. A medical home can provide your child with the very best because the staff knows you, your child, and your child's health history. Because the staff knows your child, they can make sure your child gets the checkups, screenings, and shots they need to stay well. Work with you in planning your child's care. Tell you about community programs and resources that may be helpful, and help you find the right specialist and equipment for your child. Also remember, the emergency room is for true emergencies only. True emergencies are times when children may lose their lives or risk their health without immediate treatment. If you're ever in doubt, remember, your child's medical home is available 24 hours a day, 7 days a week to provide medical advice. The staff at your medical home can tell you if you should treat your child at home, make an appointment with your medical home, or go to the emergency room. And finally, let's take a moment to compare and contrast Health Check and NC Health Choice. Health Check is North Carolina's Medicaid program for children, providing free insurance coverage for children who qualify. Requires no enrollment fees or co-payments. To qualify, family size, family income, and the age of the child are taken into consideration. NC Health Choice is insurance coverage for children who don't qualify for Health Check, who also may not be able to afford private insurance. Requires small co-payments and a yearly enrollment fee. How much you pay for co-payments and enrollment is determined by family income. Both programs cover children from birth to age 19. and in some cases up to age 21. Offer the same benefits, which include but are not limited to checkups, prescriptions, sick visits, dental care, immunizations, hospital care, lab tests, counseling, therapies, surgeries, medical equipment, and vision and hearing care. If you don't qualify for Health Check, you are automatically evaluated for NC Health Choice using the same application. As parents and guardians, it is our job to provide the very best for our children, and there is no more basic need than proper medical care. The Health Check and NC Health Choice medical insurance programs are easy, affordable ways to make sure all of our children remain healthy and ready to fulfill the infinite promises life has to offer them. Make an investment in your child's future. If your child is currently uninsured, apply today.